My name is Dr. Elie Ghanem. I work at UAB Highlands. I do mostly hip and knee replacements, primary replacements, first-time surgery, as well as revision surgery, and we also provide same-day joint replacement for those patients who are interested. You'll know that you need a hip and knee replacement when the pain becomes very severe, no longer tolerable. You feel stiff in the morning. You can't basically keep up with friends and family. I think for the most part, friends and family will tell you that you're not able to keep up with them anymore. It's a very slow process that accumulates with time. And so you'll notice after many, many years that you're just not doing what you used to do maybe 5 years ago. And so that's probably the best indicator of when you should do it, when you're no longer able to achieve your goals in life and what you like to do with family and friends. Same-day surgery, a replacement for hip and knee replacements, first-time surgery is a new procedure. It's a new protocol that has been developed in the past 2 to 3 years. It is relatively new still. Some centers are performing this, and of course at UAB Highlands we're one of the first in Birmingham to supply patients with the possibility of doing a same-day surgery. And what it entails is basically you have your surgery in the morning, you get done somewhere after an hour and a half of surgery and anesthesia. You're able to walk afterwards, and then we can discharge you safely home around 3:30 or 4 p.m. That's what it entails in terms of doing same-day surgery. You don't have to spend a night in the hospital. You can go home the same day. There are numerous benefits for doing same-day hip and knee replacements. One of them is that you don't have to stay in the hospital. You can recover at home, and studies have shown when you recover at home outside of the hospital atmosphere, it gives a sense of a feeling of being back home, that things are going back to normal faster and quicker. Plus, being in the hospital really doesn't change much in terms of from a care standpoint, especially if you have you're medically stable. You can do your therapy at home. So really, we are going away from this notion that you recover in the hospital, but rather you recover back home with family and friends. If you don't qualify for same-day surgery, we do have quite a bit of qualifications. There are some exclusion criteria that we have. They're very stringent. We do want to do this in a safe manner. So if you have heart problems, lung problems, kidney issues, then we would not have you in the same-day surgery program. You'd go and be part of the normal program that we have, where you'd have your surgery. You'd still walk the same day. You would still have therapy, although not as aggressive as a same-day surgery candidate. And then you would probably leave home the following day, after you've completed your therapy. So it would be a difference of about one night at most. I want the patients to know when they're having their hip and knee replacements, it's a holistic evaluation of the patient. We want them to know, when we assess the patient, it's not just by x-rays alone. We look at how functional they are, what their expectations. Expectations are key to what they want to achieve. We want to meet their expectations, and that's why setting the goals for each individual patient's expectations are key.